Good day guys. In this video, we'll study about the abnormal uterine bleeding or AUB. So this is Dr. Rahul Asam here. I will guide you through the whole topic. So starting with the definition of abnormal uterine bleeding, from the title we could make it that it is a menstrual bleeding that is abnormal obviously and or irregular in frequency, duration, and or intensity. So this abnormal uterine bleeding may or may not be accompanied by dysmenorrhea. So next we'll study about the etiology of abnormal uterine bleeding. So coming to etiology, we use a significant classification to distinguish between the structural and non-structural causes of abnormal uterine bleeding, which is called as Palm-Cohen system. So the structural causes comes under Palm and the non-structural causes comes under the Cohen system. So what are the structural causes do we know? Or what are the structural causes that comes under the Palm system? So it starts with polyps, adenomyosis, leiomyomas and hyperplasias, and malignancy. And coming to the non-structural causes, which is the Cohen system, we have coagulopathy, ovarian disorders or ovulatory dysfunction, and you have iatrogenic factors which is acquired from the hospital, and then finally you have not otherwise specified. So these are the etiology of abnormal uterine bleeding, right? And also there is one more cause, like so the threatened or missed or incomplete abortion, which can also cause abnormal uterine bleeding. This comes under one of the structural and non-structural causes, right? So now we'll study about the types of abnormal uterine bleeding, all right? So we have acute and chronic. So you have acute AUB and chronic AUB. So these types can be defined as starting from acute. So the acute AUB is nothing but episodic uterine bleeding in a non-pregnant female individual or in a non-pregnant woman of reproductive age. And that is of sufficient volume to require intervention. To prevent further blood loss. So as we know, whenever there is a disease, we classify it as acute and chronic. So acute is a condition where the patient presents with symptoms rapidly, where chronic usually, when it lasts for more than 6 months, acute changes to chronic, right? So chronic AUB is defined as a uterine bleeding of abnormal frequency regularity or volume, so that persists for more than 6 months. So that is when we call it as chronic AUB. So acute AUB is nothing but any abnormal or episodic uterine bleeding in a female. So when we understand that these symptoms require a sufficient intervention, or these symptoms have reached a certain stage where we require intervention to prevent further complications or further blood loss. So that is when it is called as the acute AUB. And when this persists for more than 6 months, we call it as chronic uterine bleeding. And also, according to the classification we spoke earlier, according to the etiology, we also have various number of types, such as AUBC, where it follows the Cohen system. You have AUBO, AUBE, AUBI, and AUBN. So these are the types of abnormal uterine bleeding. So I hope you guys are clear with this. So next we'll study about the diagnosis of AUB, right? So coming to the diagnosis, so number one is the gynecological history of the patient. So gynecological history is very important, where we gather the history of the age of menarche, and you get information about the LMP, the cyclic length of the menstrual cycle and its irregularity, about pregnancy, and you ask about the family history of the patient and the recent complaints of the patient, and you gather the information about the characteristics of abnormal bleeding. Right? So the next diagnostic procedure could be the physical examination. So once you take the history of the patient, we do physical examination, right? So when we do the physical examination, if we find that the bleeding is acute, we got to ensure that the hemodynamic status is stabilized. So we ensure the hemodynamic stability of the patient through physical examination, alright? And also you do the pelvic examination, which comes under the physical examination, and you do microbiological testing to rule out gonorrheal or chlamydial infection. So in pelvic examination, we look for a severity and the source of bleeding. We look for some neoplasms or structural abnormalities, right? And we do pap smear to rule out the cancer. And you run some lab tests such as the complete blood count to rule out anemia. And you do the platelet count, the prothrombin time to rule out bleeding disorders, right? And evaluate the value of beta HCG to rule out pregnancy. And evaluate the values of thyroid function, prolactin, serum iron to rule out any secondary causes of the uterine bleeding. And we can also use pelvic ultrasound and endometrial biopsy. So these are the possible diagnostic procedures we do to confirm the diagnosis of abnormal uterine bleeding, right? So finally, speaking about the treatment, number one, you have non-hormonal management. Where the hormone therapy is not needed, you do symptomatic treatment for pain with the NSAIDs. So what does NSAIDs do? So they inhibit vasodilator prostaglandins. So obviously they decrease pain, and also they decrease bleeding in uterine blood vessels. So this is chosen as the first line therapy. And in case of bleeding, you have tranexamic acid to control bleeding. So in case the patient has bleeding, this is the first line drug used to stop bleeding, right? And then you have hormonal management. Such as progesterone, and you also use GnRH analogs, and you use androgens. So the usage of androgens leads to endometrial atrophy. Right? And then the final one is the surgical management. So we can use the procedure called as the DNC, dilation curettage, and bilateral uterine artery embolization. To stop bleeding, and also endometrial ablation. So this endometrial ablation is usually preferred in old women. And then you can do hysterectomy. So I hope you guys are clear with abnormal uterine bleeding. So I'll give you heads up on the next video. Thank you for watching.